Hello and welcome to today's Here's to Your Health podcast. I'm your host, Don Linsman. My guest on the podcast today is Dr. Michael Luft. Dr. Luft is a family medicine provider in the CCMH Medical Clinic. And Dr. Luft, thank you for joining me today.
Oh, thanks for having me.
So we're going to talk a little bit about men's health today because June is Men's Health Month. And came from a lunch and learn today because there's a lot of great things about that. But one thing that you and I just talked about briefly is men don't talk about their health all that much. They're pretty closed-mouthed about that, I think sometimes even with their spouses, and I'm sure that in your experience that's what you found.
Oh, very much so. Men tend to shoulder a lot of the responsibilities and burdens at home. Not saying that moms don't, but dads also do, but men are notorious for not taking care of themselves and taking care of everyone else in the family. So it's important for men to seek medical advice, see their doctor at least yearly. There's a lot of silent symptoms that men don't pay attention to, and it's important to have those frank discussions with your doctor and get checked out.
So we're going to talk about a number of different things today. First of all, I think we want to talk about the fact that men really should come see their healthcare provider at least once a year for no other reason than to get a PSA test.
For sure, yeah. There's a lot of good screening labs that need to be done every year. PSA is paramount for men, especially over 45 if you're high risk, for sure starting at age 50. And those are sometimes the symptoms are subtle, and that score can be very high, and early detection is the key.
And I also think that when you come to get your blood work done, because you have to do that in order to be able to get that prostate scoring number, in order to be able to know what that looks like, there are a lot of other things that we can tell from a blood test that I think would go a long way toward men having better health. And some of those things include things like blood sugars. For
sure, yeah. Most guys don't. Diabetes is on the rise in the United States, and more so than ever in Iowa. We're finding more and more people with type 2 diabetes, and it's when our body's insulin is resistant to our own insulin that we make. And so a lot of times when we find it, the disease has progressed fairly quickly, and we're unaware, and a good screening blood test can detect type 2 diabetes early.
This is the Here's to Your Health podcast. Thanks for listening. My guest on the podcast today is Dr. Michael Luft. We're talking about men's health because June is Men's Health Month. And I think one of the other things that typically for men, because they don't talk about things like this, is they put up with a lot of different sort of health things that are going on. But one of those happens to be stuff that might be going on with their heart. They don't really say much about it. Those annual visits, though, could come in really handy when it comes to being able to determine if someone has heart disease and determine it earlier rather than later.
Yeah, there's been a lot of good advancements with technology, and at CCMH we do a coronary artery calcium scoring test. The test is offered. We've got a newer advanced CAT scan that can detect atherosclerosis in our hearts earlier and determine who's at risk and needs to treat that earlier rather than later.
And of course, diet and exercise plays a huge role in all of the things that we're talking about today. Just from your perspective as a primary care physician, what would you say to men who maybe aren't getting a balanced diet, aren't getting enough exercise?
Yeah, it's very important that we stay active. We get a good 10,000 steps in a day. We eat less packaged foods. We eat more healthy, fresh foods. Leads to a healthier life. So it's important to get in to see your doctor, get good advice on improving your diet, find out that your heart is healthy enough to get good exercise, and have those discussions with your doctor on what the next step is to get healthy.
You know, one other thing that came up today in our discussion was about sleep and how important that is. I mean, to be honest, diet, exercise, and good sleep are pretty much the building blocks for good health for just about anybody. But sleep sometimes can be pretty elusive for people, and I think we've talked about it on the podcast more than once how important sleep is. Maybe you have an insight or a perspective on what we can do if we're struggling with our sleep, if we have issues where we either can't get to sleep or we wake up during the night.
Yeah, sleep is an important part of health. Getting at least 8 hours of sleep a day is shown in the studies that help us have less disease and lead a healthier life. And it's another factor that, along with exercise, diet, controlling our weight, sleep is something else that we can control to improve our health.
Yeah, and sleep, I think, does have a bit of something to do with overall health, especially from the standpoint of our weight issues. Sleep does have something to do with whether or not because if you're run out of energy, you don't get enough sleep. I think people tend to overeat. They take in more calories than they need because they're looking for something to help them make it through the day, so to speak.
For sure, yeah. When we get less sleep, studies have showed that we produce excess cortisol, which can activate our hunger, require us to eat more calories, and that in turn makes us put on more weight and then get less healthy. So it's very important that we get plenty of sleep, and therefore it can help us stay healthier by not eating as much.
Yeah, and the reason you want to come see your provider is the sleep studies and other things that we can do to determine maybe what those issues are and how we treat those.
Yeah, sleep hygiene is important. If you are having sleep issues, it's important to see your doctor so they can diagnose what the sleep issue is. And we've got great modalities with polysomnograms and other sleep aids, and do a good inventory of what may be causing you not to have great sleep so we can get that corrected.
My guest on the podcast today is Dr. Michael Luft, a family medicine provider here at CCMH. We're talking about men's health because June is Men's Health Month. A couple of things just to finish up, Doc. When it comes to vaccines, and not necessarily talking about COVID, there are other things that we could be paying attention to, especially as men get older. What are some of the things that you'd recommend men do if they're getting close to, like over 50, closer to 65?
Yeah, the shingles vaccine is a very important vaccine. When we get to age 50, it's given 2 months apart, has great prevention for developing shingles. Shingles can be very debilitating, and it can be very dangerous if it spreads to your eye. So it has great prevention. More than 95% of people will be protected if they get the two vaccines. The flu shot is very important each fall. Flu creates a lot of health issues, pneumonias, missed time from work, so it's important to get your flu shot. Your pneumonia shot, there's a new pneumonia vaccine out, pneumonia 20, which we should get as we age, and then also get our tetanus boosters every 10 years.
You know, as we get older, we also have memory issues. We're going to finish this way today because even though I don't have maybe some of the memory issues that other people have, I'm getting to be a geezer. So I know that that's going to happen. If people men find themselves being a little forgetful, what would you suggest?
Most important is everything we've talked about: getting good exercise, controlling your weight, no smoking, getting plenty of sleep. Studies have shown that if you can average more than 7 hours of sleep as we age, it does help our memory. The other key factor is, just like you want to stay physically fit and stay active for good muscular health, you also want to work your brain out. You want to do things that challenge your mind, word puzzles, reading, and not just being someone that's glued to a phone device, a television. Actually keep your mind stimulated will help memory. And if none of that is working, you should visit with your family doctor and have the proper testing to make sure there's no early memory issues or dementia, that your family doctor can intervene sooner.
For those people who are listening, especially those men who are listening today who do not have a family medicine provider, if you'd like to come see Dr. Luft or any of the other providers that we have here at CCMH, you can make that phone call at 712-265-2700, or you can go online at ccmhia.com and you can request an appointment out there on our homepage. And Doc, thank you very much for your time today.
Oh, thanks for having me.
My guest on the podcast today, Dr. Michael Luft. We're talking about men's health because June is Men's Health Month. I'm your host, Don Lintzman. Thank you for listening today. Have a great day.